Thank you, Mr. President. I want to commend you for asking us to come here, and I will say that never have so many members of the House and Senate behaved so well for so long before so many television cameras. So if we ever get to a conference committee, we may want you to be the moderator. I do think, though, that there is a fundamental difference in the vision that you and your friends on the majority have put forward and the vision that myself and those of us in the minority have put forward. It's the fundamental role of government. We believe that we should use free markets to empower people and give them choices. And for the best of intentions, yourself and most of your allies in the Democratic Party seem to believe that the government, either through a mandate or through a regulatory requirement, knows better and will do better for health care for most Americans. Now, whether you have a mandate or simply give the Secretary of Health and Human Services the ability by regulation to require something, that's a difference that's a distinction without much of a difference. So the 6 common sense ideas that various Republicans have put out here is not incrementalism in the sense that it doesn't go together, but it does not radically change the basic health care system of America. If you give the ability to sell insurance across state lines and prevent a state from precluding it, if the insurance company can prove that it's solvent and that it will pay the benefit, health care costs will go down in that state and premiums will go down. There's a study just out that in the state of California, health care premiums would go down 50% if Californians could buy insurance from Nevada or Oregon. If you create a catastrophic high-risk pool and put the cap on it that Leader Boehner did on his alternative on the House floor and allow small businesses to create the kind of pools that we've talked about, you're going to be able to give those Americans who can't get insurance because of a pre-existing condition and want it the ability to get into those things, and their premiums will not go up catastrophically. They will not go up astronomically. And one of the things that we seem to have agreement on, according to yourself and Senator Durbin, is medical malpractice. Now, your proposal and the House bill and the Senate bill pay lip service to medical malpractice, but they don't really do it. Again, if you take the Boehner proposal that was put together and put up on the House floor, and it's based on what's happened in Texas, which put in medical malpractice reform in 2003, premiums for medical malpractice have gone down 27%. Texas has gained 18,000 doctors since this reform was put in. There are 55 rural counties in Texas that now have an obstetrician. If that is extrapolated nationally, you're not going to save the $54 billion that Senator Durbin alluded to and that yourself alluded to if you combine the direct savings with the indirect savings because the price of practicing defensive medicine goes down. You probably save $150 billion a year. Now, that's real money. So what we're saying, Mr. President, we're not talking about incrementalism. We're talking about, as Leader Boehner said and Senator McConnell said, let's start over in the sense that we change the vision and work together to do the things that we agree upon, but do it in a way that doesn't destroy the fundamental market system that's made the American healthcare system the best in the world. And if we do that, we can make a deal. Well, thank you, Mr. President. Thank you, Leader Boehner.